One of America's biggest battles has put racial disparities on full display.
As we continue our courageous conversations, looking deeper into issues of race, equity, and equality. 10 on your sides, Anita Blanton joins us with her special report. Anita?
Well, thank you, Stephanie and Regina. The numbers here are telling. According to the CDC, Black, Hispanic, and Native American people are all more than 2 times as likely to contract COVID-19, have more than 4 times the likelihood to be hospitalized, and Black people are twice as likely to die from the virus compared to white people. I talked to Virginia's Chief Diversity, Equity, and Inclusion Officer about those statistics that have put state officials into overdrive.
Virginia now boasts a first-of-its-kind health equity working group created as an emergency response body to COVID-19. Stakeholders from all around the Commonwealth with a seat at the table, often seen standing by the governor's side to save lives at a critical time, but more importantly, out in the communities that need help the most.
We know that we are living in unprecedented times, and the larger health crisis is really structural inequity and structural or systemic racism. And so for that reason, we already knew that there would be a disproportionate impact on people of color and those who have historically been marginalized.
Chief Diversity Officer Dr. Janice Underwood talked to me about the all-out effort to prioritize equity when it comes to health, starting with more clearly defining who's at risk.
When you say vulnerable or at-risk communities, it's usually a dog whistle for saying Black and brown communities or poor communities.
Households of $30,000 to $40,000 incomes with 4 or more occupants who may not have the privilege of social distancing and may have 1 or more comorbidities, making a fight against COVID not just complicated, but far too often deadly.
We've used the Health 360 technology tool, really used GIS mapping and census tract data to pinpoint neighborhoods down to the door, where we literally help local governments go door to door or have large events.
They're handing out masks, hand sanitizer, and public health information
to clear up misnomers about this public health crisis, so that they would know things like drinking bleach was not advisable.
They've held webinars about accessing state and federal resources, and they're connecting local organizations that can work with the government to link arms with them in the fight.
What difference do you think this has all made?
Our numbers are certainly trending downward, but I will say that those inequities have not gone away. The Latino and the Hispanic communities are disproportionately high in positive cases, and the African American or Black community are statistically higher with regard to death seen by COVID-19. Both of those statistics should alarm all of us towards sustained action.
When you're talking about Black and brown communities, there's also a huge issue of trust that you have to get past.
We know there's a historical, and might I add, Anita, a justifiable mistrust in Black and brown communities with regard to healthcare, with regard to government, and with regard to law enforcement. So where all these crises are now intersecting and colliding with one another, we know that we need to give people who have never had a seat at the table a seat at the table.
She says they are trying to go to every corner of the Commonwealth to make sure everyone knows they matter, we're in this together, and we are one Virginia strong.
And our thanks to Dr. Underwood for her time. I'm going to put a link to their strategic plan to attack historical inequities and make systemic changes under this story on WAVY.com. And you should know that this is just a part of our second Courageous Conversation special that airs this weekend. Tune in Sunday at 10:30 on Fox 43 or keep it right here on WAVY TV 10 after WAVY News 10 at 11.